So I want to welcome everyone to our webinar that is focused on K through 12 and higher ed engagement when it comes to epilepsy outreach. Today is August 21st, and you are a part of the Epilepsy Foundation's Public Health and Education's activities. So if we can go to the next slide. So I am Tometta Cozart. I'm not going to read my bio for you. Most of you probably know me, but if you don't, I serve as the Multicultural Outreach and Health Equity Director for the Epilepsy Foundation, and I've been doing that for nearly 7 years. And so I actually manage our multicultural outreach and public health activities that have to do with our Public Health Institute and our social determinants of health outreach mini grants. And this activity is a follow-up of our Public Health Institute. So if you can go to the next slide. We do have funding from CDC. The Centers for Disease Control and Prevention has given us a cooperative agreement, and we've been funded by CDC for nearly 20 years, for more than 20 years, actually. But that means that still this particular webinar does not actually represent the views or values of CDC or our project officers specifically. If you can go to the next slide. So again, I want to reiterate that we did have our Public Health Institute that is focused on building inclusive communities to look at determinants of epilepsy and some of those social unmet needs of those who are living with epilepsy. And so we had this in March, and so this is a follow-up of that discussion. So for this particular webinar, we are going to talk about the importance of engaging schools and colleges and universities into the aspect of our into the aspect of the work that we do. Then we also are going to talk about the aspect of some of our programming that is specific to classrooms and teachers and what we've learned as we've implemented that project. And then lastly, we're going to hear from one of our national partners to really talk about offices of disability and accessibility on college campuses and how you can work directly with them. Ultimately, we're hoping that you leave here with either skills or tools or resources to make you more feel better and like you have more opportunities to be able to work with schools, or for you to be able to look for actual partners and allies to do this work. If we can go to the next slide. So the mission of the Epilepsy Foundation is to improve the lives of those living with epilepsy and are affected by education, advocacy, research, and connection. Next slide. So we are a national nonprofit. So we actually do have affiliates that are around the country. We also have regional team members that work in a variety of states. So here you can see our makeup. And if you're in one of these states and you're not connected to one of our affiliates or one of our regional team members, please do reach out to us and figure out how you can be connected, and we can get you connected. We want for especially our guests that are from AHEAD or any of our other partner organizations, we want to make sure that you're working with us definitely on a local level. Next slide. So I just want to give again a little bit of a overview for epilepsy, and just again to talk about the purpose of why we're here for those who are not a part of our network. So we do know that epilepsy can impact anyone, but we understand and know that there are some aspects of intersectionality, of some determinants and some variables that actually make some aspects of living with epilepsy more difficult than others. If you can go to the next slide. So the CDC, of course, has determined that epilepsy is a public health problem. And this is why, again, we understand and know that even for the Epilepsy Foundation being an advocacy organization that focuses on our patients and the families and their caregivers, we know we can't do this work alone. And this is mainly because of the fact that all of the challenges that come with living with epilepsy. And so we know that there's an increased aspect of comorbidities when it comes to having other chronic conditions, such as depression. We also know that it's an aspect of being able to have a high quality of life when you're unable to work or drive. These are all things that we know impact those who are living with epilepsy, and thus we need to be working with other people outside of just the neurology field. So we can go to the next slide. So understanding some of those educational and epilepsy disparities, we understand and know that actually when it comes to education, those disparities actually mirror what we see in health. And unfortunately, a lot of the disparities that we see with children living with epilepsy persist throughout their K through 12 and college journey. And so we see that these disparities actually are reflected in the aspect of their test scores, in the aspect of repeating some grades, having a higher dropout and graduate and lower graduation rate, and also the aspect of them being involved in gifted or talented programs is lower. We also understand the fact that because of that decline in their academic performance, especially if they're having reoccurring seizures or poor control of their seizures, then that means that more than likely they are less likely to graduate high school. And we also know that they're less likely to actually either pursue or complete a college degree. You can go to the next slide. And so that's why we're here today. We really want to talk to some of our many grantees that are doing outreach to schools and colleges and hear from them. But we also want to hear from our consultants that are helping us to actually further our educational programs that really focus in on teachers and schools. And then again, our national partner AHEAD, who was not able to join us at PHI. We are grateful to have representation from them here today. So I'm going to introduce them briefly and then allow them to actually give more of insight in terms of who they are and what they bring to the table in terms of their programming. But I just want to briefly give you intro to each of them and then let them speak accordingly. So first, we're going to hear from Dr. Kalia Fleming, and she is serving as a consultant for the Epilepsy Foundation on a part-time basis. She's focused on our Epilepsy and Seizure Safe Classroom Program. Formerly, she was the executive director for the National CMV Foundation, which was also a partner in our work in terms of looking at children, again, who were living with a variety of comorbidities, but epilepsy or seizures being one of those because of their CMV diagnosis. She has an undergraduate degree from Spelman College. She has served in the Peace Corps. She is bilingual in Spanish, and then she has received her doctorate from Johns Hopkins, focused on health literacy. So after that, we will hear from Heather, and Heather is a certified rehabilitation counselor, and she's been doing that for more than 20 years. She's been working in higher education and disability administration, and so she currently now runs the rehabilitation services at the University of Illinois. And before getting that particular position and working on the aspect of the accessibility and disability services in Illinois, she's worked in Chicago. She's worked for Purdue. She's worked for St. Louis University and Washington University in St. Louis. So she comes with a variety of aspect of professional experience, and she's our representative for the Association of Higher Education and Accessibility and Disability, but she herself is a person living with epilepsy, and so she gives that perspective as well. So we're really looking forward to hearing her tips of how we can, again, better engage college campuses and look at their offices of disability and accessibility as allies in our work. Then we will hear from Anina Perry, and so she will talk about the aspect of what her and her family has been doing with their foundation. So with the Kayla Ross Perry Memorial Foundation, which was founded in 2019, she has been working on being able to increase outreach to communities, and mainly communities of color, African Americans and Black communities, because of the aspect of their lived experience. So unfortunate as it being a memorial foundation, this is in the name of her daughter. They did lose their daughter to SUDEP, and so before she succumbed to the aspect of seizures, she actually was able to finish her college degree, but wanted to be able to pursue more with that. And so this is an opportunity for her to talk about some of the things as a parent that they have been doing, her and her husband, to be able to have this opportunity to do more outreach to schools so that they are more aware of how they can support the families that we work with. And then after that, we will hear from Janet Romeo. And Janet was with the Epilepsy Foundation of Long Island. And she's been there since, well, actually, she has just been promoted in 2024 as the Director of Epilepsy Services. And she's been working with the organization for a long time. And so her responsibilities really do include the aspect of referral, education, support, and advocacy. And she actually does that throughout Long Island to be able to ensure that more people are trained in seizure first aid, that they're aware of all the training opportunities. And some of the work that she's been doing has really been focused on the aspect of working with colleges and being able to actually integrate some of our trainings into their curriculum. So we're really interested in how she's been able to do that. So with that being said, I am actually going to turn it over now to Dr. Fleming. So we're going to switch slides really quickly so that everyone is able to see her presentation. Okay, with that, Dr. Fleming, I turn it over to you.
Thank you, Tametta. And good afternoon, everyone. Please excuse my voice. I am a little bit under the weather, but super excited to be with you all this afternoon to share some really important data and lessons learned from the pilot implementation of the Seizure Safe Classrooms initiative. And I'll speak a little briefly about what all that entailed. Next slide, please. All right, and you can go to the next slide. All right, so a little bit about the program. So the objectives for the Epilepsy and Seizure Safe Classroom Program, which I served as a consultant with, was to define seizures and epilepsy. We wanted to make sure it was done in an appropriate, age-appropriate, grade level appropriate way. We did this by creating toolkits. So there's a toolkit for K through 5, 6 through 8, and 9th through 12th grade for this very purpose. The toolkits contain information about defining seizures and epilepsy, recognizing calming seizures, identifying correct and incorrect steps for helping a person having a seizure. So yes, we wanted to make sure it included seizure first aid, dispelling common myths about epilepsy, and increasing awareness and empathy towards people with epilepsy. That was something very big we wanted to do with this initiative, particularly for students in and outside of classroom settings. We wanted to make sure that there was empathy and compassion amongst peers. So you can access all 3 toolkits through the Epilepsy Learning Portal, the ELP. It's an online educational platform that actually does provide training resources and multiple courses, not just this one, for educators, healthcare professionals, caregivers, and the general public. So at the end of my presentation, I do have the hyperlink, particularly for epilepsy and seizure safe classrooms. You can click on that link. That'll take you straight to where you can access the toolkits for the program. Next slide, please. Okay, so a little bit about what the program entails. As I mentioned, we created 3 different toolkits. And each toolkit contains the toolkit overview and access form. That's irregardless of if it's K through 5, 6 through 8, or 9 through 12. All of the toolkits have this overview form and access form that needs to be completed. It does also include a facilitator guide that is in each toolkit. You have the high school 9 through 12 toolkit content, which is videos. So we had to craft and create new age-appropriate videos for high school and middle school students, quizzes, interactive activities, and handouts to reinforce concepts that were taught, but also to ensure that students could properly demonstrate seizure first aid in and out of classroom settings. The same applies for the middle school content, and then the elementary school content. We didn't have to necessarily recreate new videos. We had some great videos that were still amazing, and through focus group testing, realized that it would still be a great fit to incorporate. So we kept those videos. So for the elementary toolkit, what we mostly focused on was creating interactive activities, quizzes, opportunities like that to reinforce learning. As I mentioned, there's a facilitator instructor guide. There are also evaluation forms in the toolkit, and then digital assets. Really, really cool digital assets, logos, stickers, both electronic and physical, that can be printed so that schools and community-based centers can kind of showcase that they're participating in this program and that their students and teachers have been educated about seizure-safe classrooms. So again, the main focus of the toolkit and the program overall is really working with this K through 12 population. I want to put a pause in that here. We often hear that and we think of just classroom settings, but the toolkit can and should be implemented not just in classrooms. Think of your youth groups, your youth ministries, summer camps, Boys and Girls Club, any type of after-school group or activity that interacts with K through 12. Can absolutely utilize and leverage this toolkit. And so again, the purpose is to make sure we provide age-appropriate, grade level appropriate resources about epilepsy, Seizure First Aid. We want to make sure we increase students' awareness of epilepsy and their empathy for peers who may struggle with epilepsy. Next slide, please. All right, so let's jump a little bit into some of the preliminary data we have about actually what launching the product, our pilot launch, if you will. I'm going to start with some students. So for the high school toolkit, it does include, as I mentioned, PowerPoint, quizzes, interactive activities, some role-playing scenarios. High school differs from the other toolkits as well, in that we also created an on-demand course. So let's say a student's not in class that day, or you're at the Boys and Girls Club and want to just show this on-demand course to your group of seniors, or students just want to watch it at home. Specific to the high school students, we did create an on-demand course. And right now, what we see from data as of early this month, that we have over 700 high school students that have actually registered for this course. More than 130 who've completed the course have shared their feedback regarding their experience with the course. And I'll get into that in a little bit. In addition to that, we actually use the Teen Speak Up program that the Epilepsy Foundation has to launch the new Epilepsy Youth Education Ambassador program, which provided this training, this Epilepsy and Seizure Safe Classrooms training to students so that they can be trained on how to use the toolkits, share the toolkit materials with their peers as part of their year of service requirement. And so we've actually trained about 20 Teen Speak Up ambassadors to do just that. What have we seen from both those youth ambassadors and those students who've taken the on-demand course? Preliminary data is showing that about 94% felt that the course significantly improved their understanding of epilepsy, which is huge. You have about 82% who expressed confidence in their ability to assist someone during a seizure, which was one of the main points we wanted to make sure we emphasize. If you're out and about in the classroom, in the gym, in the hallway, and you see another student having a seizure, what do you do? And then confidence applying knowledge, 85% said that they totally feel confident that they can help someone using what they learned. Here we have some quotes from some students who provided their feedback. My favorite part was hearing from the kids who have epilepsy because they shared what it was like living with epilepsy, and I got to see it from a different point of view. We were very careful in our content and in our toolkits to include real life stories and testimonies from students or young adults who have epilepsy. And so this goes to show that resonated well with those students who actually participated. And then we have another quote. My favorite part was learning about different types of seizures and also getting to know what to do if someone is having one. It's very important to highlight here, as I mentioned at the top of the presentation, we wanted to dispel common myths about epilepsy. A lot of students, a lot of adults hear the word epilepsy and automatically think of convulsions. They don't think of different types of seizures, symptoms. And so we were very careful in the actual curriculum and the content to highlight different types of seizures as well as signs and symptoms. Next slide, please. All right, go back one. There you go. All right, thank you so much. Now, outside of that high school on-demand course and the training of the youth ambassadors, what about those teachers, school nurses, other adults who wanted to access the toolkit and use it in their classroom and non-classroom settings? So we have about 400 individuals since launch who've obtained access to the toolkits. Again, the toolkits have PowerPoints, bite-sized videos. None of the videos are more than 2 minutes, so they are engaging, they're short, but they're powerful. Quizzes and interactive activities about epilepsy, seizures, and seizure first aid. I wanted to highlight some of the feedback we've gotten from the actual facilitators because I think that's key in moving forward. We have here the first comment. It would be beneficial if the program functioned like a video, allowing me to pause it at different moments, and switching between the slides and the video was somewhat challenging. So as the program was originally set up, the toolkits, we had the videos embedded in the PowerPoint presentations. Once individuals clicked on the video, it would open up a Vimeo file to then show the presentation. Some folks felt like that was a little bit too tedious, so we have provided some suggestions. We provided a tutorial now at the onset of the toolkit access form, which shows you how to kind of alleviate that navigation issue. We see here the content and the training is great. The students like the videos and it was short and to the point. I like that it's not just a person standing up there talking for 45, 60 minutes. We wanted to totally stay away from that. And I think we really achieved that with this. Mixing up the videos with class discussion keeps the students engaged, and we've heard that quite a bit. And then someone says, I'm also looking for ESL materials and training for adults and staff with no medical or healthcare background. And I think that's important for two reasons. One, we did get some feedback that the program or the toolkit materials may need to be tailored to students with different disabilities or learning disabilities. So I do want folks to keep that in mind as they're accessing the toolkit. Secondly, during some of the focus group testing, some teachers were like, this is great, but I'm still very scared to do this on my own. Can I pair or partner with the school nurse or school health professional to help me provide this education? Because I don't have the medical background. And absolutely, that's something we now recommend and we highlight in our trainings moving forward as well. The last thing I like to highlight, I guess one of the big major feedbacks I see in the preliminary evaluation data is, any terms that students struggled with, and it seems like epilepsy and what epilepsy is, the neurological disorder, how what it can manifest as and look like for some students was still a challenge. So I would definitely encourage those who are actually utilizing and leveraging the toolkit not to be afraid to spend extra time if needed on those epilepsy specific videos. What is epilepsy? We do have a video for that, as well as some of the content in the handouts that can be helpful for that, just to make sure there's no nebulous, no hazy confusion around what is epilepsy. And I will end with this quote from a facilitator. Their discussion, meaning the students, continued beyond the classroom. I could hear students discuss what they learned as they walked through the halls. Next slide, please. All right. Most importantly, the Epilepsy Learning Portal, as I mentioned before, houses multiple courses, not just the Seizure Safe Classrooms. So to the comment on the last slide about additional courses for healthcare providers and non-medical staff, I would definitely recommend folks go visit that page. And then here is a specific link to the Epilepsy and Seizure Safe Classrooms Toolkit. You will need to sign in, register, create a free account to access those materials. And I believe, Tameta, you all did share that in the chat. Is that correct?
That is correct.
All right. Thank you so much for sharing that. And I will turn it over to the next speaker.
Thank you so much, Dr. Fleming. I would like to highlight the fact that unfortunately she is going to have to leave our session early. So if you do have questions for her, please do put them in the chat with your name or even your contact information, just so we can ensure that you're able to be connected with her if you need that. If not, then our training team will definitely answer your questions. So again, thank you so much, Dr. Fleming. All right, so let me turn it over to Heather.
Good morning and afternoon, depending upon what time zone you're in. For some of you, it is still morning. Dr. Fleming, I just want to say thank you. I'm actually, as was mentioned in my bio, I have epilepsy and had my first experience with epilepsy as a child and really had no prior knowledge of what epilepsy was, nor did my family. And so it was a process to navigate that, and I'm still doing that as an adult. And so having some training materials would be so valuable. I didn't even have a sense of, in the K-12 experience, could I work with my public educational system to discuss resources that might be available to me when I was actively still experiencing seizures, which was really impacting my memory and other things. So thank you for all that information. It's really good to know that there are training materials out there now for families and young ones who are experiencing this themselves. So just to reintroduce myself, I'm Heather Stout. I'm the Director of Disability Resources and Educational Services, or DRES. We often go by our acronym. We're located at the University of Illinois. I'm also actively involved in the Association on Higher Education and Disability, or AHED. So today I'm really representing both higher education and then also AHED as an organization to talk a little bit about how students can access accommodations or inquire about accommodations in post-secondary level. And I want to stress this. I didn't even think that I was someone who could do that when I was going into college and trying to figure out what resources were available. So I do encourage all of you out there who may have questions to reach out to institutions, to colleges, and find out if they do have resources that you can use. So I want to talk a little bit about just the process in general for connecting with accommodations at the college level. And then and some information about my organization. So here you can see my bio, which I just kind of talked through. Also, I'm a rehabilitation counselor, and if sharing a little bit more about my own story, I chose that path because of my experience with disability. And during the time when I was in college, the Americans with Disabilities Act had passed, and I wanted to find a career path that would allow me to kind of use that lived experience and work with college students. So I'm in the field because of my own experience with disability and wanting to work with young people who are experiencing disability. Next slide, please. If you could go on to the next slide. Okay, thank you. So I just want to talk a little generally about, for anyone who may have questions about accommodations, academic accommodations at the college level, there's a lot of consistency across all of us, although we may have different specific processes. But most colleges and universities are going to have either an office or an individual that is a contact point for anyone who may be requesting disability accommodations. Often that's going to be an online process, meaning that an individual can go to our website, and then there's an online portal through which you can document and request accommodations. And include documentation from your healthcare provider that helps outline what specifically the nature of the disability is. What I would share is that in most cases, there are some exceptions to this. Requesting disability accommodations is separate from the admissions process to college. So students still need to meet the admission criteria. Most often, disability is not considered as part of that admissions process. So often we will get inquiries in advance of students applying to university who just want to know what's available at the University of Illinois. If I were to come to your institution, what resources could I access? And that can often be an important factor for determining which institution one may want to attend. But in general, our information that we collect with students is kept separate from admission documents and academic documents that a university holds. So that admissions process is going to be separate from our application process. Typically, you can visit the college website. I would recommend visiting the college website. And even if you just enter into the search engine for that website, disability resources, you should be able to pull up the office that works with students who are seeking to request accommodations. That's a good way to find it. If it's not on the college's homepage, that is, from there, some universities will actually have a link to disability resource programs right there on the homepage, but others you may need to look within their search engine to find out where their office is. I would recommend just confirming what is the application process that the college that you're interested in has. And also it can be very helpful to know what documentation, that is, what medical information from your healthcare provider that college is going to request. It may vary college to college, but essentially all of us are going to be looking at, we want something that is describing what your current disability or what your current health status is and how the epilepsy is impacting, specifically in academics, is what we're going to be inquiring about, so we can figure out an accommodation plan with a student. But we want something that's current, so it's reflecting what you are experiencing right now. And if you have questions about what services are available or what the process involves, I would highly suggest reach out to that disability resource program directly. Usually we'll list a phone number, an email address, or you might even have an online message system that you can submit a question through. But ask them if you do have questions about what's available at a given university. Next slide. Thank you. So I just wanted to kind of share with you one example, which is us, University of Illinois. So for example, for us, if a student wants to apply for accommodations, there is a link to our application, and I've included it here, but we don't need to open it now. If you can reference this later. So students actually complete this online application, and then they upload their documentation as part of that. And in our case, that application system is called My Access Center, or we often call it MAC for short. We also have a page, actually a number of pages, that share documentation criteria so that if there are questions that students have about what they need to provide, or if they want to discuss that with their healthcare provider, with your neurologist, for example, you can share that specifically with your neurologist and kind of figure out what you need to provide. Again, what we're really seeking is current information about how the epilepsy is impacting, so we can figure out what accommodations are we going to want to put in place with the student as they work through their program. Once a student submits their application, then we review that. All of DRES, by the way, is Disability Resources and Educational Services, our program. So DRES will review each request, and then we'll actually schedule a meeting with that student or prospective student. Very often, parents are involved, particularly with high school students who are transitioning to college. That's very common, and often parents have some valuable information. But what I would share with parents is that we really do want that student's self-report and their own description, because they are the source of describing how they're impacted within the academic space. And that's really what we're trying to get at. But again, we do understand that students have support network, and family is very much a part of that. So we will include the family in that. With this, what I also want to point out, this is very different than in high school, because, and I'll talk about this in a moment here, but in the college system, the student is the source. And so we're working with the student directly. It's not the family. And the student is self-documenting with us. It's the reverse of what happens in K-12, where actually the system is connecting with the student and identifying that the student needs resources. In college, it's the opposite. So the students connect with us, and then we work to create a plan together that can evolve as they move through their program. So then we formalize an accommodation plan with the student, and that can be updated throughout the semester and the academic year, and certainly as courses change or a disability changes, because for most of our students, many, I'll say, disability can change throughout their college work. And so we may change accommodations with the student. Many of us in higher education will then, once we have an accommodation plan, we'll create a letter of accommodation that students can then share with each of their professors, that basically states the student has documented a disability with the institution or the university, and that they're approved for accommodations and what those accommodations include. What the letter of accommodation does not include is what the specific disability is, because it's not so much what the disability is, but how that disability impacts in the classroom that's really relevant for the faculty member. So faculty are not going to have access to your medical documentation. They're going to have access to this letter of accommodation. So we include what's really important for them to know, which is I'll give you another example that's not epilepsy. Let's say it's a deaf student who works with sign language interpreting. The letter might say, student will be working with a sign language interpreter in the classroom. Or if it's a captionist who's working with a student with a hearing disability, it might say presence of a transcriber who will transcribe in real time any information that's shared in the lecture. What I also added here, the final bullet point, is that prospective students may request to meet to learn more about what's available at Illinois. And we will offer those meetings because, again, as I shared earlier, it's often an important question, you know, if I go here, what will I be able to access versus if I go somewhere else? Are there other resources that are going to be important for me that may be available here, or do I need to do I want to look elsewhere in addition to the actual program I'm seeking to study? Next slide, please. So just to kind of give you a sense of some of the resources that we have available at Illinois, most of the students who are requesting accommodations use some sort of testing accommodation. I mean, that's the most heavily used accommodation I would say that our department works with. So we have a testing accommodation center that offers such things as additional time, or some students may need to take exams in a distraction-reduced environment. Other students may use like a memory aid, a calculator, things like that. So our testing accommodations center can work with any students who have accommodations related to the testing space. We also offer assistive technology for students if they say have a visual disability. It might be that we work with them to determine that they have the right screen reading software, or if students need note-taking assistance, we might connect them with note-taking tools such as Genio, which in some cases students in high school are using, but we definitely offer note-taking resources in the college level. We also have an accessible media services area, which deals with alternate format of text materials. So, you know, a great example of that is if a student has a visual disability or say dyslexia, we can actually take materials and convert them to accessible format for students to ensure that they can access all of the reading content or media content that a class may involve. We also offer academic coaching. Not all institutions do, but now most institutions do offer tutoring and academic coaching to some capacity. It may or may not be in the disability program itself. It could be in the academic colleges, for example, instead of us. At Illinois, we have always had a heavy focus on physical disability. About 25% of all of our students document a physical disability. So we offer a transportation and campus accessibility area. We actually have a small fleet of buses that offer point-to-point transportation for students. So we connect them with that, and they can use that throughout the academic year. We also have mental health counseling within DRES. Most universities do offer mental health resources or work with a community-based resource so that students can access mental health. We actually have a team within our own department that also offers mental health, specifically for students who may be needing to talk with someone about their disability and just the impacts of their disability. We also have a career services coordinator within DRES. And so students who want to begin working on internship opportunities and career path goals, we have a coordinator who can work with them. And then finally, I don't know if folks in the audience are familiar with vocational rehabilitation. Here at Illinois, we actually have staff who are in the building who are working they're part of vocational rehabilitation, and they can work with students who are here at Illinois and want to connect with voc rehab resources, which can help with supporting tuition costs and such. So again, just some examples of accommodations to consider. So in the testing space, extended time, distraction reduced space, memory aids, use of a calculator, Text conversion of print materials is a fairly common thing that we work with. Note-taking assistance, I mentioned Genio. That's a software that basically it listens to the lecture and then it creates notes for the student while they're also taking their own notes. So it can be really helpful for someone who maybe is able to capture a lot of content but may miss some content. It can also help organize the notes. Another one which would be relevant to potentially to individuals with epilepsy would be modification of attendance, which may be important if there are medical issues that may impact during the course of a semester. So it can allow a student to work with a professor to plan around additional absences that may happen with related to seizures, for example. Just a little bit about the Association on Higher Education and Disability. As I said, I'm actively involved and have been for over 20 years. And so AHEAD we have members throughout the United States, every state and Canada. We also have colleagues from Japan and in some cases Europe. So we're basically US based, and we do a lot of work around training for our colleagues who are all working in disability access in higher education. It's, as I said here, and this is directly from their website. I've included their website link here, but AHEAD is the leading professional membership association for individuals committed to equity for persons with disabilities in higher ed. They host training opportunities and meetings throughout the year for those of us who work in higher education. And then there are also regional affiliates, just like the Epilepsy Foundation. We have, in most cases, they're state affiliates, but for example, in my case, Iowa and Illinois have a joint affiliate together, ILOA. And so they're different regional affiliates that professionals can get involved in to do training and meetings throughout the year, in addition to AHEAD's own training materials. And then for those of you who don't know AHEAD, there's also a student component to that, which is DREAM, or Disability Rights, Education, Activism, and Mentoring Group for college students with disabilities. This is college students who lead this effort themselves and really create content around the student experience, the student disabled experience. So that's just a little bit about AHEAD, and we won't visit the links now, but please feel free to visit the links here later, and I will pass it along to Kayla. Thank you very much.
Thank you so much, Heather. And just a little bit of background again for AHEAD. The Epilepsy Foundation has established a national partnership with AHEAD, and we have been able to provide seizure first aid training to some of their members. But we really do invite everyone to actually look to see who your member is in your state and reach out to them and offer them, some of the resources that we have within the foundation in terms of, again, if students come in and disclose to them who have epilepsy or seizures, but they're not connected to our organizations. That's a way for you to be able to get referrals. But then also if you're working with families that have college age students and they're not, sure what they even should be asking for in terms of if the college has any of the services that Heather mentioned, please again reference this presentation and seek out assistance from an AHEAD member. And if you need help making those connections, please by all means reach out to me. Okay, all right, let's keep going with Miss Perry.
Before I go into a little bit about what we've learned over the past couple of months, I want to introduce myself. Thank you, Tameta, for sharing a little bit about us. My name is Edana Perry, and I am the co-founder of the Kayla Ross Perry Memorial Foundation. And back in 2019, after being devastated by the unexpected loss of our daughter, Kayla, who was 26 at the time, we wanted to do something that would honor her memory and give back to the community. And so the foundation was born. Our purpose is to raise awareness about epilepsy and SUDEP, to support those who live with epilepsy, and to give scholarships. When Kayla transition, as Tameta mentioned. She started out at Morgan State University in Baltimore, but after her epilepsy caused a little bit more concern for us, she transferred and was able to complete her associate's degree at Montgomery College. And we do remember when she had to be empowered to go and meet with a disability person at Montgomery College. And it was a shift for me too, as a parent, because up until that point, as a parent, it's like we're kind of navigating for them. And Kayla had to go to her disability person, speak to them, let them know what she needed. So I'm grateful for that. So what are we doing now? We have committed the Kayla Ross Perry Memorial Foundation to helping those families who are dealing with grief. And we also want to help families who are dealing with epilepsy now. And so annually, we do a health expo where we are sharing with the community and those who are living with epilepsy about those things that Kayla enjoyed. She loved Zumba. She was a singer. She loved to cook. And we talk about mental health concerns for our community. And so we're excited about that. But what also makes us excited is how we were given the opportunity to be a part of the SDOH grant program. And with that program, it has given us the opportunity to begin to share information with our community about epilepsy and seizure first aid training. And so what I'll talk today about is some of the things we were able to do, as well as our challenges and barriers and things of that sort. So one of our objectives was to provide seizure first aid training to K-12 local HBCUs in the DC, Maryland area. And so I'll be honest with you, it was a little challenging in the beginning. We made phone calls, we were leaving emails, and realized that because of the timing, it was near the end of the school year. It was really hard to actually connect with those individuals that we needed. And so, but we didn't give up, and we asked for help. And you can go to the next slide. Hello? Is there another slide? I don't know. Are we stuck?
Hey, Mrs. Perry, we're working on it.
Oh,
Sorry
okay.
about that.
Oh, no, it's okay. But while they do that, so what we have realized, and I think some of it may have been touched on by Dr. Fleming, we realize that it at times is challenging for those living with epilepsy to step up or to share. Okay, here we go. Okay, so here are some lessons learned and how we move forward to continue on our objective. One of the things we realized was, you know what, let's just pivot and change. We're not trying to get attached or get connected with individuals that we don't know. And so let's just start at what we know and who we know. So we were actually, my husband is a teacher. And so we did our first seizure first aid training with his colleagues at the end of the school year this year. And so it was very successful. And his colleagues were excited about it. And actually, he'll be doing another session coming up this year. Number two, We were also trying to get connected with the Association of African American Public Health Programs. Again, using emails, making phone calls. Wasn't easy at first. And what ended up helping us was, of course, Meta making that introduction. And so we actually are sponsoring our first seizure aid training with that group actually next week. So we're excited about that. Next slide. So, you know, one of the observations that we have taken away in our past couple of months is that, let's recognize the current climate that we're in. Um, Educators are challenged with large classroom sizes, limited personnel, and the school system is faced with shrinking budgets. And so sometimes it's hard to really connect with people who are in the school system. The system is large and bureaucratic. So then you just have to rethink a new approach for the school year. And so my second box there talks about a different way to approach. We found out that the school system has a community partnership office and they have community schools office. And so we're beginning to reach out to them and creating a flyer so that my husband can pass his information around, so that basically it's like the power of one. The power of one. Just start with one. And once you're able to make your presentation or connect with one, they will then help you gain entry into the others. And of course, to approach the PTAs and booster clubs, and then leverage the relationship that you do have with the new ones that you want to create. I think that is it. And there is the flyer for our training coming up, which will be on Tuesday.
All right, well, thank you so much. And again, anyone who has yet to be trained in seizure first aid, again, we are going to have a little bit more of a focus on colleges and talking about student and faculty and staff aspects of why they should want to learn seizure first aid, but this is open to the public. So anyone who is yet to be trained, please join us next Tuesday at 2 o'clock. Okay, so now we will hear from Janet.
You're on mute, Janet. You're on mute.
I do it all the time. Thank you. So I was just greeting everyone. Good afternoon. Thanks for being with us today. First of all, I want to thank Meta for inviting me to be part of today's conference. It's an honor to join the distinguished panel of colleagues and advocates that have already spoken today. So my journey began in 1997 when I took on the role of community educator for the Epilepsy Foundation Long Island. Since then, I've witnessed great progress in the quality and reach of our programs, and that's completely due and thanks to the dedication of our national team and their commitment to developing comprehensive, impactful training programs, which have greatly advanced public awareness of epilepsy and understanding of seizures. At the Epilepsy Foundation, I always say that with education comes understanding and acceptance. And so education is a huge piece of what we've always done here at the Epilepsy Foundation Long Island. I was lucky enough to inherit a program from my predecessor who was already providing a lot of education in the various different school districts on Long Island. And we take great pride in delivering the resources that we are provided with from the national office. The support is immeasurable. So reflecting on the Public Health Institute meeting this year in Atlanta, the whole conference was wonderful. I learned a lot, but I left deeply inspired by the words and the energy of Dr. Deanna Washington. For any of you who remember, she was from the American Public Health Association. I think she's the president, if I remember correctly. And she was just so inspiring. And her message really reignited my passion and reaffirmed the importance of continuing our important work in the field of public health education. So next slide, please. So these are some of the things that I took away from PHI this year, plus some other things that, I've thought about in the past and from a couple of other sources. But I just wanted to share some approaches for engaging with educational institutions and things to keep in mind. So number one, of course, we know it's all about partnership. Helen Keller once said, alone we can do so little, together we can do so much. And it's absolutely true. But the thing is with partnerships, they go two ways. So just remember not to always reach out in terms of what you need, but reach out to find out what those organizations may need as well, and get involved with those schools on other levels, participating in health fairs or community events or whatever they may offer. So, have that ongoing relationship. We also, we have wonderful material, as I've said already, that National has provided for us, and we need to share that and showcase it to the individuals at the schools and colleges and so on, so that they can see that our material is relevant, important, that it is well thought out, it's professional. And especially I'm excited about starting to share the classroom toolkits with school staff so that we can really increase the number of schools that are receiving training. Utilize your students, engage your students with epilepsy, your families that have contacted you. Engage them in leading a campaign to get the school on board and create an event for awareness, to dispel the stigma and to empower their peers to know what to do to help them. CEUs, I think that's really important to be able to offer the CEUs to staff and faculty, for their licensure. So having the CEUs for the school nurse program and the certification for the seizure first aid is wonderful. Something I'd like to see in the future is credits being available and a program curriculum available for school social workers and psychologists, and credits for them would be wonderful. Let schools know about your awareness campaigns. November is Epilepsy Awareness Month. Purple Pumpkin Project in the elementary schools, and the students can champion those initiatives. Include people with epilepsy in your training opportunities so that they can share their journeys, and that can be so much more impactful than me standing in front of an audience going on and on about epilepsy. Get as many emails, contacts as possible and add them to your databases from the schools. We send out a newsletter to our families every week, but I also send that newsletter out to about 700 school nurse email addresses that I have. So just letting them know what's going on in the world of epilepsy, inviting their students to volunteer for our walk and get involved. Maybe reaching out to the school to see if they have a newsletter and including an article about epilepsy in their newsletter. And let your parents know that you can support them, at least provide them with information for their 504 and their IEP meetings. I do sit in on these meetings during the year, but I have to let my parents know that that's a service that we provide. Most people would not realize that they have support. They have someone who will sit in on those meetings with them to help the school understand what epilepsy is all about and how it affects a student, and then come up with a set of accommodations that can assist that student. I know here, I let parents know that they can require the school to provide epilepsy training in their IEPs or their 504 plans. They can actually require it. Okay, they can't require who provides the training, unfortunately, but they can require that the training is done. And once the school finds out that we do that for free, they would be foolish not to take us up on it. And so, I have provided many, many school training programs for staff. Okay, next slide, please. So how do we do it here? Well, we reach out to primary and secondary schools, both private and public, and colleges and universities as well. But back in the day, I only would reach out to the school RNs. And then I realized, there are other people at the school who would be interested in our training. So I expanded my outreach to guidance counselors and social workers, school psychologists, health education and physical ed teachers. We do the Take Charge of the Facts or the Take Charge of the Storm program with health teachers who call us, and we actually visit the school and go from health class to health class with the Take Charge of the Facts program. Transportation departments. In our schools, some of them are part of the school district and some of them are private companies, but we try to reach out to those. And then, of course, the special education department in your school district. So those are the main folks that I reach out to in the colleges and universities. It's the disability services departments. I've worked with a few of them. I was on a board at Farmingdale College that was trying to get the word out about their school in general, but I sat in on that committee and was able to get epilepsy education onto their campus. There was a student who actually went around putting up seizure first aid signs around the school campus. We also have collaborated with them to hold conferences at their school. And other colleges and universities as well. The health center, their campus security departments, I'm reaching out to currently to try to drum up business for the LEO, the law enforcement program. And then, of course, the residential services, the RAs that are there to help students when they're living on campus. I mean, this is a crucial set of folks that need to get our training. Next slide, please. So who is our audience here on Long Island? Long Island has about 3.2 million residents. It's broken up into two counties, Nassau and Suffolk counties, Suffolk being much larger than Nassau, but Nassau being much more dense than Suffolk. So the population is about equal. And we have 352 public and private schools in Nassau and 343 public and private schools in Suffolk County, and 13 colleges on Long Island, and many, many trade schools. I don't even know the number, but we try to reach out to all of these entities. Next slide, please. Okay, and so here are some of the projects and things that we've done, and I use the time frame 2020 to 2025. After COVID, sort of that post-COVID era, to just look back at our numbers and what we've done. And granted, the first year or two were really difficult trying to get back into schools. They had so many other priorities. So it was slow going for the first few years after COVID. But since then, we've done 121 presentations of Take Charge of the Facts or the Storm to over 2,600 students. And what I'd like to call attention to, and I know these pictures are very small, but in this picture, the very top picture on the upper left corner, that is a student delivering the Take Charge program. It is she is a student who lives with epilepsy. And so there she's participating in the training herself. Another thing that some school faculty and teachers have told me is that a demonstration, an actual demonstration of seizure first aid rather than watching it on a screen would be really helpful. So we did that in another class here in the next picture. We've also done seizure training for school personnel, 65 presentations in the last few years to over 2,100 school staff. We've provided seizure training for school nurses, that program, 3 presentations in the past several years for 80 school nurses that represented about 50 plus schools. And then we also provide our seizure recognition and first aid certification class. Now, this statistic here is just for the students in 4 colleges that we've trained as part of their curriculum. And just to explain that, actually, we can go on to the next slide. So the way that came about was that I had a teacher that I had been following for many years doing the Take Charge program. She was a permanent sub-health teacher. And so she would move from school to school, and she would bring me from one school district to another to provide the training. And then she moved on to being a college professor. And so that's how the partnership with Nassau Community College started. They started a CHW program, a community health worker program. And my colleague suggested that our seizure first aid certification be part of their CHW curriculum. And that has been happening for probably about the last 5 years. So that's been a wonderful opportunity to get actual future CHWs certified. We've done the same in a couple of other colleges, attending their health fairs. I get the most out of like making contacts when I'm there, having someone else man the table while I make some connections with people. But certainly participating in those health fairs further develops that relationship with the schools. Another picture here is of a club that a young man with epilepsy belonged to on campus, and we did a presentation for his club. Again, participating in their resource fairs. We collaborated with another college to hold a conference there regarding transition with epilepsy. Yeah, these are the colleges where we're fortunate. We have about 13 colleges and universities on Long Island. I think that's the end of my presentation, but next screen? No, I'm not. I'm sorry. Also, these are some suggested community connections other than the schools themselves, but these are organizations that are heavily involved with the schools. And so obviously getting involved with PTAs and especially special education parent-teacher associations or SEPTA organizations is very helpful to getting the word out there. We here in New York have an organization called BOCES, the Board of Cooperative Education Services, and they support the school districts, especially in the area of nursing and in the area of special education. And so I've collaborated with them to actually train the school nurses in the school nurse program. Nassau County Association of School Nurses, Suffolk County Association of School Nurses have all been instrumental in getting our programs into the schools. And there are some other organizations here that I have not worked with yet. I have reached out to perhaps, and still trying to develop those relationships. I think that is the end. All right. Okay. All right. Well, thank you again for that opportunity.
Thank you so much, Janet. And I know that we are slightly over 3 o'clock. We were hoping to be able to get this done in 60 minutes, but we did plan for it to be around 90 if needed be. So I know we might have lost a couple of people, but again, that's what the recording is for. So I'm not sure if there's any questions specific to the presentations that are in the chat or not. So I'm going to yield to my colleague, Shell, to let us know.
So there were specific questions around Heather's presentation, but she actually answered those questions in the Q&A. So other than that, there were no other additional questions in the chat box.
Okay, great. Great. Okay, so with that being said, I'm going to say thank you to all of our speakers. I'm going to put up our survey so that we can get our remaining participants to please take our survey so that we can know how this was helpful to you. If there's any other additional information you would like to know. And then also, again, seeing those links that we talked about before. So while you guys are taking that survey for us, I want to bring up a couple of things in addition to, again, saying thank you so much to all of our speakers. But I want all of you all to consider them as resources for you as well. So if you want to be connected with them individually, please do let us know so that we can make those connections for you. And then also I want to make the point in terms of the aspect of as we consider going back to school, right? School has started for a lot of already colleges and universities, but please do consider the aspect of midpoints and aspects of breaks. So most schools do have at least a semester or a quarter, depending on the way that they operate. And so when they start back up, that is another opportunity. There's usually some type of training. There's usually some type of orientation. There's usually some type of planning period where they still could have some aspect of professional development. There's still an opportunity to be able to talk to faculty about seizure first aid and other training being incorporated into their curriculum. For example, I'll use one of our other partners that we've already mentioned, the Consortium of African American Public Health Programs, which will be doing the seizure first aid training with them next week. One of the great things about working with them is that they are 14 historically Black institutions across the country who all have either a public health program, health education program, or a medical school. And so by working with their program directors, we've been talking about how can we actually incorporate seizure first aid into their courses, right? So it's their actual requirement so that they're getting college credit and they're able to turn in their certification, their certificate as a way for them to actually get credit. That's a great carrot for faculty, right? Because seizure first aid is self-contained. They don't have to do anything to teach it that particular period. They also can become instructors themselves. So that's something that then they can actually give it as something that they can look at for their students before they go off onto internships. So there's a lot of opportunities when it comes to colleges where they like our trainings if it's presented to them the right way. So if you need help and assistance with that, please do let us know so that we can support you in that. Okay, so I am going to say thank you again to everyone. We really appreciate you all taking the time to listen more. Heather, did you want to say something? Yeah.
Meta, there's a question in the chat actually about someone was asking if the slides will be shared.
Yeah, thank you. I can't see the chat, so I appreciate that. So yes, we will be sending out the slides, and we also will be sending out to the recording to everyone who registered. So of course, if you're on this webinar right now, you registered, we have your information, so you will automatically get that. However, again, if you do want people's individual contacts, or if you do need a resource or help or support for something that was mentioned here today, but you don't see the aspect of like how to do it, or even the aspect of being able to do it in your state, right? We talked about a couple of states. We gave examples from New York. We gave examples for Illinois, but if you didn't see your state, you know, and you're really showing kind of how to do that and you need help and assistance, please reach out to us so that we can get that to you as well. Another last point I want to make, and then we will let everyone go, is specifically about the toolkits that were mentioned with the epilepsy seizure safe classrooms. And I wanted to bring this up because this actually came up with our mini grant project, and we had our meeting yesterday. And South Carolina is one of the states that just recently passed seizure safe school legislation. And so the teachers are required to take that training, but they're not required to actually take it in terms of having live instruction. And that was something that, we had to learn, that the law doesn't say that they actually have to have live instruction. And so some of the teachers, after they went online and took our training on demand, wanted more. They wanted more assistance. They wanted examples of how do they actually integrate what they've learned. That's what the toolkits are for. So think about that, especially if you're in a state that has passed Seizure Safe School legislation. Think about coming back to those school districts to say, okay, now that you've had all your school personnel trained, if they need examples for activities, if they want to have the kids engaged, look at these toolkits as an additional opportunity. So all right, everyone, thank you so much. Did any of our speakers have anything else they wanted to mention before we sign off? No? All right. Well, as always, it's a pleasure to have this time to be able to talk to you all about, again, how to engage, how to do outreach, but really how to support our community in ways that, again, we may not have considered before. And so the educational space is one of those areas that, again, unfortunately, we are aware of some discrimination and just lack of support. And so we just want to be that support and fill in that gap. So thank you for taking the time today to learn about how we can do that better. All right, so I am appreciative of everyone, and we will let everybody go. Have a great day.
Have a good day.